So I just want the country and the members of Congress and those that are in their offices like I was listening to the debate to understand the healthcare industry, which is 15% or 20% of our GDP, in which the preliminary scores on the draft and the bill in the Senate somewhere between $1 and $2 trillion over 10 years, which is somewhere between $100 billion and $200 billion per year, which is 2% of GDP. A bill that's going to add 2% of GDP, which is not yet written. If we're really, really lucky next week, we may get 2 days of markup in the Committee of Primary Jurisdiction. Now, I want to put that in context. I've been in this body 25 years. I have seen major bills that were not half as important as this bill have weeks of hearings on the legislative once the legislation was out, and weeks or months of markup. A former chairman of the committee, John Dingell, in the Clean Air Act in the 1990s, marked that bill up in committee. He worked on it for several Congresses, but the final work product he marked up over, I want to say, a 6-month period. It is arrogance beyond explanation, not just to the minority members of this body, to the moderates, conservatives on the majority side, but to the American people, that we can attempt to move a bill that affects 20 to 25% of our GDP, which adds 2% of our GDP cost per year for the next 10 years, not even have that out that it can be studied today, but when they get around to introducing it sometime next week, they're going to start marking it up on Wednesday and report it out on Friday. Now, the reason I came over to ask time to speak is because right now I'm in a debate with the administrator at the EPA, Administrator Jackson, in which back in April they issued an endangerment finding on CO2, saying that CO2 is a harm to public health, is a dangerous element, and therefore has to be regulated to protect the public health. We have emails that show a reputable senior PhD doctor researcher within the EPA prepared a report as required by law that stated that the science that they had based the endangerment findings on was faulty and out of date, and in all probability there really wasn't a danger. And that report was not made a part of the official record. And the email says it wasn't because his direct supervisor says the decision has been made at levels above you. We're going to go forward with this, regardless of what the facts are. And so here we have, on climate change and cap and trade, the facts be darned, we're going forward. And now we're coming to the next big issue in the Obama administration, and they're saying, the public be darned, we don't want anybody to know what's in the bill. We're going to make the majority vote for it no matter what, and we're going to do it in 2 days. Now, most of you here, medically trained, went to medical school for years, had an interns program for several years. Most of you practiced in private practice for decades. You got experience. You had your patients that trusted you because you were open and transparent, and you had experience behind you. The majority that's running this body doesn't have enough trust in the population to tell them what's in their bill a week or two ahead of time so we can study it and prepare amendments and have an open, fair markup process. I think that's outrageous. We don't know what's in the bill. Mr. Shattuck has done a pretty good job of going through the draft, and he knows that the draft is scary enough that we ought to have a long, fair markup on it. Most of that stuff will probably be in the final bill, but we don't know. So the reason I came over, Congressman Burgess, was to encourage you and all the other members that are participating in this special order, the people that are watching it, they need to get on the phone tomorrow. We want openness, we want transparency, we want time to see what the bill is. We want to post it on official websites so that the public can understand it. We want to give members on both sides of the aisle the opportunity to draft amendments, and then we want a markup process in the committees of jurisdiction that those amendments can be made, they can be debated, and that they can be voted on in public, and maybe, just maybe, the work product that comes from that will be worthy of being reported to the floor. But one thing I'm certain of, the bill that we don't have that's being drafted in secret is not worthy of becoming public law. I can say that sight unseen.
If the gentleman will
I'd be
yield.
happy to yield. But I just want, before I yield back, I want the American, you know, in the Revolutionary War, one if by land, two if by sea, the British are coming. Rationed Health Care is coming. No doctor choice is coming. Private insurance is going away if we let this. I don't know. I'm trying to think of a polite way to describe what's about to happen, but it is a travesty of the process, and it is a policy that will do much more harm than good to health care in America. So.
Well, I just wondered if the gentleman would yield for questions. We had, of course, a meeting of our committee this afternoon talking about amendments when we thought we had 3 or 4 days, which in fact seemed pitifully short in that context. I know our office had submitted 50 amendments. I think I saw a list of almost 200 amendments that was being discussed. There is no way in the 10 to 12 hours that will be available to us to debate that bill to allow members on our side, let alone if any members in the majority have ideas about how the bill might be improved. It's a virtual guarantee that only a very limited number of voices are going to be heard, if any, to try to improve that bill in the time that we have allotted to us. And I'll yield back to the ranking member.
I plan on talking with Chairman Waxman immediately in the morning and saying that at minimum we need a day to look at the bill once it's out, and we need several days to prepare amendments, and then we need at least a week or 2 weeks to do markup and make sure that it's not just the minority members, but there are a number of members on the majority side that have substantive concerns and substantive amendments. This Congress can do good work, but it can't do good work in the dark with a handful of members making deals in the back room and then forcing the majority to almost automatically rubber stamp that product. So what you're doing here is excellent work, and I commend you and the other members, but I strongly, strongly encourage, if people believe in an open, fair process, we need to figure out a way to get this bill out there in public and give us enough time to study it before we go forward and try to mark it out.